Hello, doctor. How are you?
I'm wonderful. How are you, Donna?
Thank you for inviting us to Passaic.
Yes, welcome.
I've already had a great morning here today. What made you decide to open your practice here in this particular town?
So I grew up in Clifton, which is the next town over. And my mom is actually a dentist, and she's been practicing in Passaic for about 20 years. And I've always been a part of the office, her office. And there's no other oral surgeon here in the town, so I knew that this was the perfect place to go ahead and start my business.
I guess growing up with a nice smile, right, is also like a requirement.
Yes, actually. we couldn't make it out the womb without one.
Sometimes there's a confusion between what a dentist does, what an oral surgeon does. Can you explain the difference a little bit to us, please?
Yes, so there's different specialists in the dentistry field, and the confusion I think comes from not too long ago, maybe 30 years ago, the general dentist did it all. They did the extractions, they did the braces, they did the root canals, and as the profession has evolved, then you have specialists. So you have one person the endodontist only does root canals. The periodontist only deals with bone loss, dental implants, stuff like that. The oral surgeon deals with surgery stuff, and the pedodontist only sees children. So I think as the profession has evolved, we're kind of branching out into different specialties, and I think that's why it's confusing, because a lot of patients will come in and say, well, my dentist did everything. He took out this tooth and he did that root canal and he did this crown. So I think it's a little confusing, but I think the patient care is better because you're an expert at what you do, right? So I take out teeth, and I've had patients that come in and say my dentist took 10 hours to take out my tooth, and I don't take that long because I do this all day. One of the most transformative procedures that we've done is they call it all on X, or just when people have a lot of broken down teeth, a lot of teeth that had root canals in the past, just kind of failing dentition, and we kind of clean house, take out all the teeth, we place 4 to 6 implants, and we are able to fixate a denture made out of zirconia, which is, I actually have a sample of it, but that is the most transformative procedure.
Okay,
Patients
so you can
feel
give them a whole new smile.
Yeah, they have like a new lease on life. They just feel so much more confident. They can smile, they can eat, they can chew, outside of the confidence from smiling and kind of normal life interactions, is that they're able to actually function, and they're able to chew, and they could eat steak and apples and stuff like that maybe they haven't eaten in many, many years.
Yeah, so. I haven't heard of that before. So
yeah.
You're able to get someone that has no teeth that couldn't eat an apple to be able to sometimes eat an apple.
Yes. So this is what we call an all on X. So X meaning it could be 4 implants, 5 implants, 6 implants, 8 implants. Okay. So this patient in particular has 5, and she had no teeth before. She hasn't had teeth in 20 years. And
oh my gosh.
Now she's going to have this beautiful new smile, and this is made out of zirconia, which is, the aesthetics are phenomenal, and the strength is also phenomenal. It's one of the strongest substances that you can use to chew.
Yeah,
yes.
No, that's really wonderful. So yeah. They always laugh. They say that George Washington had like wooden teeth or whatever.
Yes.
There's a far cry from wooden teeth.
Yes, okay. No.
So this company has developed a way to make the human tooth even like better, like create something that looks like a human tooth, but I mean that looks like a real tooth.
Yes, this is so porcelain is what they used to make a lot of the crowns, even from 50 years ago. But this it's stronger, so it can be so it's stronger, so it doesn't have to be as big and bulky, and also aesthetically it's more superior than you can get the gums, you can get the teeth, you can see the different shading in the teeth.
Beautiful.
Which it's no one's gonna know that these aren't your teeth.
It's funny too, because over the course of the years, like somebody accidentally took like the microphone and like hit me and chipped like my front 2 teeth. Like, so my smile over the years, I'm 60 now, it has changed changed a little bit. You know, my teeth are still mine, but it's nice to know that if any time I couldn't, you have options. Even if they're not in the entertainment industry, I think having a great smile brings about so much confidence, so much joy. I know that you have a person here actually that said she'd be willing to talk to us about her journey, right?
Yes.
And what's their first name?
Rena.
Okay, hold on just a second. Let's hear from Rena.
What dental issues were you having before?
Yeah, little by little, I'm losing a tooth because I'm drinking apple vinegar to help my sugar low. Before, I keep on going to somewhere else, and they told me that, oh, you need to take care of everything. And I said, no, I don't want to do that. I'm just want to do partial. Having the procedure, I'm very proud to myself. It's like I'm like being young again. Yeah, I'm being young again. I'm not feeling old or something. I'm young. Yeah.
Okay, and what is this?
So this is called an overdenture or a snap-in denture.
Okay.
And when you don't have any teeth or when you have to take out the teeth that you have left, the denture really doesn't have the support. So everyone's seen their grandma's denture, it's huge.
So in the cup sometimes?
Yeah, in the cup, yes. So having some implants, 4 on the top or 2 or 4 on the bottom, allows you to snap in the denture. So the denture is getting support from the implants, not just from your gums. So that allows the denture to be a lot smaller. It doesn't have to be as big and bulky as, you know, your grandma's denture.
Understood.
And basically, you get the 4 implants, and the denture has little holes that attach onto the implants, and it just kind of snaps in.
Lovely.
And
it's like sometimes if I want to have an extended ponytail,
Yes.
I just kind of like snap in the extra length.
Yes,
it's kind of like that in a way.
Yes,
Okay.
exactly.
So this is
for your mouth, yes.
Yeah, but for your mouth. This is a really big decision to go have oral surgery with somebody, right? So you
Yes.
kind of like do baby steps with someone, or
no, we just,
you just put them
get
right in.
Oh, yeah.
You just get them in.
So no, so usually they call. So we get patients 2 different ways. One way we get patients is that the doctor sends the patient over. You know, they know that they need a tooth out. They know that they need certain procedures. So they'll come in ready. They'll kind of already know a little bit about us because the dentist already told them. And then we have patients that just find us on Google.
Really?
You know,
Okay.
They read our reviews. They feel comfortable. Or sometimes patients call their insurance, and whoever takes their insurance, that's where they kind of call around, and they kind of know that they need the surgery.
Okay.
Some patients know that they need surgery for years, and you know,
And
it's
this is
just
the
kind
moment.
of this is the moment. So.
Why do people often have to take their wisdom teeth out? And have you noticed there's like this trend, not a trend, but like have you noticed like people only sometimes don't have all 4?
Yes.
Like evolution or something's
Yes.
happening where they're like not born with wisdom teeth anymore.
Yeah. So so one, our mouth is not as large as it used to be. I think it has to do with our diet, also evolution. So a lot of people's wisdom teeth don't fit in their mouth.
Got it.
I actually went to a museum in Philly, and there was like 200 or 300 skulls, and I looked at all of them.
Not at the eye sockets. You're looking at the
I was
jawbone.
looking at their wisdom teeth, and the wisdom teeth had space. They had more space to be in the mouth. Like sometimes we get, most of the wisdom teeth we're taking out, it's because they don't have space to be in the mouth. Usually if your wisdom teeth are in your mouth and they're not bothering you, then it's not a problem. But most of them are upside down, they're sideways,
cutting into
they
the
don't
cheek.
fit. Yeah, half of them is in, half of it is out. So, and then we do find people that have 2, that have 3, that have 1. I actually had twins, identical twins, and one of them had 4 and the other one had 3, which doesn't make sense.
No,
but
that doesn't, right?
but I took them all out, so it's okay. But
7.
Yes, it's 7.
It's 7. Lucky 7. So a lot of times you're removing wisdom teeth or broken teeth or teeth that just don't fit or crooked teeth.
Loose teeth,
And you're able to do implants as well, right? So
Yes.
sometimes if somebody just needs 1 tooth out, you're able to give them like, I guess it's a post, and then you send out for like a crown, and or is that what it's called? I don't even know if that's what it's called.
Those are some of the words.
Okay. Because I don't have a medical degree like you do. I'm just talking in like regular smile terms, right? But so some of the things that you do is you repair smiles. Or you bring back health
yes.
to the mouth? Like, what would
Yes.
you consider?
So if you have bad teeth,
Right.
then, or you have one bad tooth, you had a broken down tooth, maybe you had a root canal, has to come out, then that's like a nidus for infection. So basically,
Oh.
you know, the body's like, what is this tooth doing here? It's trying
Right.
to attack it. So the only solution is really to take it out.
Okay.
And then when you take it out, you have a space in between, you know, teeth, or, you know, there's a space there. And what happens is that the other teeth want to gravitate towards that space. You know, they kind of shift in a way to kind of either they move into, like, forward to the space, backward to the space, up to the space, down. So by replacing it with an implant, you kind of restore the balance, and it maintains the health of the other teeth as well as your health. And then the implant is the support. So the support goes in the bone, it kind of heals there, nobody sees it.
Right.
And then after a few months of healing of the implant, then you get the crown.
Okay.
And then that's what has to be sent out to the lab. And basically they just take an impression, and in about 2 weeks you can get a tooth there. But
Wonderful.
the process itself takes about 6 months.
Okay, so people just need to be like patient and you know, calm, and
Yes.
it's all going to work
Yes.
out, and that's what your team does, I
Yes.
guess, is to help
Yes.
them realize that it's a process, but at the end it's going to be great.
Yes.
Yeah.
And some patients wait years, and then when you tell them 6 months, they're like, 6 months? I'm like, it's been 5 years. So so it's kind of just setting that expectation, of course.
And you're right, because infection, a lot of times when somebody gets an infection in their gums, it is directly related to heart disease.
Yeah.
And they just don't know.
Diabetes
It's
and
so
a lot
many
of other
different
health
things.
issues, yeah.
So
And
if
I
they
think-
have a problem with the tooth, they should get it fixed as early as possible.
Yes, and it's, I think we're just getting to the tip of the iceberg on that. I think they're doing a lot more research in terms of how your oral health is affecting your physical health, you know. So, yeah.